Today I'll go through what factors I look for when a patient comes to me with a complaint of looking tired. The first is I look at the skin quality, especially in the under eye area. If this area has lost elasticity, then the eye can appear baggy. And the reason is the fat in the deeper layers of the tissue can move outwards, contributing to eye bag formation. The second, I look for laxity. Is there droopiness of the eyebrow contributed to by collagen loss? Third, I look at the component of the muscle. If, let's say, when a patient smiles very strongly, the eyelids are pulling down, sometimes reducing that muscle pull can create a brow lift. And last, I look at volume changes, especially in the under eye area, because hollowing in the under eye or tear trough area can make us look tired no matter how well rested we are. Today, let's go over what I would do to assess a patient when their complaint is about looking tired. I talked about first looking at the skin quality. So how do I do that? So first I have him look at smile. Can you smile for me? And see how the skin folds and relax. The second I do is what's called a pinch test. If I gently pinch and pull the skin in front of the mirror, if it stays folded, it suggests there's a component of loss of elasticity. In that case, I would first recommend some treatments to improve the under eye skin quality. These may include a laser resurfacing procedure. The one we use is from the US. This is a US FDA treatment known as the Pearl. It takes off the superficial layer of the skin and replaces it with new skin to give a firmer skin with a pearly glow. A second option is microneedling. The one we use is called Dermapen. This procedure has been labeled in 2020 by CNET as one of the top anti-aging treatments. It creates tiny punctures and channels into the superficial dermis, and the skin's own healing process results in improved collagen formation. Second, I look for a component of laxity. So I look at the position of his eyebrow. So is the double eyelid, especially in the outer part, coming down over time? I compare this to older pictures, for example, to see where this is drooped down. If there is laxity, I would recommend a procedure that creates a lift. These are deeper treatments than those that improve skin quality alone, so a laser can't do it. The treatment we use at the moment, which goes into the deep layers of the skin and even underneath the skin, is known as Ultherapy. We allow to tighten deep into the skin while imaging the tissue so we know exactly where we're treating. To do an upper brow lift, I would treat this area on the outside of the brow to create a lateral brow lift, so its outer eye area lifts up. We also do Ultherapy under the brow, so it creates tightening also, and that makes the eyes just look more open while keeping it natural. I also look to see when you have a big smile, give me a big smile, does his eyes drop down? Does it pull down and relax from you? If that's the case, putting a little treatment here to relax the muscle with something like Botox can result in a subtle brow lift. In fact, Botox, depending on where you put it, you can lift the outside to create the flare. You can inject the inside to create a medial brow lift. You can also create an arched brow if that is your goal. And so Botox, you can improve the shape of the brow. The fourth component I look for is volume. Now, in Gunther's case, he's actually really good with volume. But we know the fat pad loss is in a very predictable pattern. The first is the eye area. The under eye area can hollow. Above the eye can also hollow, so the under eye hollowing can make us look tired. Second is we tend to lose volume on the middle of the cheek. Third is the temple, and the part here, it's a periauricular area, and in a lot of us also the jawbone. And so in that case, there's then less support for the volume that is left. That's the nasolabial and what we call the marionette or jowl fat pad, and these cascade downward to aggravate the nasolabial fold and the marionette line. You can see again, Gunther is very good volume and very good bone structure, so he doesn't need any of that. But let's say we do. What I would do first is assess, is he going to benefit from a cheek lift first? So you can see even when I pull this up, it's already lifting the under eye area. Second, I do what's called the press test. I press, and it's the under eye area improving, and it does. What does that mean? It means I would consider putting cheek filler on the outside to lift the cheekbone, as well as here, taking into account that a man where the prominence of the cheek is very different than a woman. You don't want to feminize a man. And a woman, whereas you can put it laterally, in a man, you need to put it a little bit more closer to the middle. The other difference, of course, is if a person is Caucasian versus Asian. Asian faces have very strong cheekbones, but are fairly flat in the front, whereas Caucasians tend to have better projection in the middle. So the placement really depends on whether a person is Caucasian or Asian, man or woman. So in his case, if we see there's an improvement when I just pull up the cheek and the eye area improves because it lifts up, then I would start with a cheekbone filler, followed by a filler in the tear trough. The filler is placed using a round tip cannula rather than a needle. A cannula, because it can push the tissues very safely, reduces the risk of bruising or puncturing vital structures, and so it's actually generally quite safe. Note that you can always have slight swelling or bruising even if we use a cannula. Be very careful in doing a tear trough filler. This area has thin skin, and too much filler or improperly placed filler, your eyes can look baggy. This is why we always do less filler first, especially in the under eye area. As I mentioned earlier, loss of volume in the front of the cheek or in the outside often happens in combination with a tear trough volume deformity. And so if I were just to correct the volume loss in the under eye area without correcting the volume loss in the cheek, I may end up making the eye look baggy because this is still hollow. And how do you know if you can benefit then from a tear trough filler and a cheek filler? Speak to your doctor for further assessment. The biggest fear that a patient brings up when we begin to discuss fillers is the fear of looking fake or unnatural. They see TV stars looking too blown up and looking too artificial, but it doesn't have to be this way. How do we avoid this and make sure that you look even more beautiful? Really, the filler should be proportionate to the rest of your face. We shouldn't aim for a different looking cheek apart from that would suit the overall eyes, nose, chin, and lip area. Second, I typically ask a patient to bring a photograph from years past. This allows me to put fillers in a very natural way that's consistent with your own natural beauty. The third, less is best. Less is always more. Always start with very little, much less than what's recommended or what we think you may need over time, even if it means having to come back for a second session. The fourth, we always look at transitional areas, which means to say, well, how does it look like in relation to the area surrounding where the filler was placed? In the under eye area, we want to make sure it looks blended with the cheek. When you put filler on the cheek, you want to make sure there's a smooth flow with the lower face. Go to a doctor you trust. It only takes a few millimeters of misplacement for a person to look unnatural with a filler, especially for the tear trough area where the skin is very delicate. Putting the filler too close to the under eyelid can make your eyes look small. The filler we use for this entire area is made of hyaluronic acid. This is a substance that's in our skin, but the filler's hyaluronic acid is modified. They are what we call cross-linked. In so doing, there's an ability of the filler to lift, plump, or reshape the contours of the face. Hyaluronic acid has been shown to improve skin quality, hydration, and also have some form of new collagen formation over time.